California governor approves 2 proposals for mental health reform, Sacramento, California. AP, California Governor Gavin Newsom signed off on 2 proposals Thursday to transform the state's mental health system and address the state's worsening homelessness crisis, putting them both before voters in 2024. The Democratic governor needs voters' approval because he wants to borrow billions of dollars through a bond to pay for the proposals. They would allow the state to borrow $6.38 billion for 11,150 new treatment beds, housing and 26,700 outpatient treatment slots to serve up to 100,000 people a year. The measure would also overhaul how counties pay for mental and behavioral health programs. Newsom spoke to state and local leaders at an event Thursday in a historic hospital in Los Angeles. The vacant General Hospital is being converted into roughly 1,000 affordable units. Newsom said the proposals will bring accountability to the system, adding he understands why residents in California have grown increasingly frustrated with the crisis. Today, again, is about holding ourselves to a higher level of accountability and higher level of expectation, Newsom said before signing the 2 pieces of legislation. It's about creating a framework where we actually can deliver. Here in LA and throughout our city and state we know that we are facing a crisis, Los Angeles Mayor Karen Bass said. We are going to transform the system, but we're also doing something that should have been done 50 years ago, and that is build the beds and facilities to make sure that people can get the treatment they need. File. California Governor Gavin Newsom answers questions during a news conference, Sept. 26, 2023, in Sacramento, California. Newsom signed off on 2 proposals Thursday, October 12, to transform the state's mental health system and address the state's worsening homelessness crisis, putting them both before voters in 2024. AP photo. Rich Pedroncelli. File. The proposals will appear together as one item on the March 2024 ballot, when voters will also be weighing in on the state and presidential primaries. Newsom and supporters said the spending would help the state make a dent in its growing homelessness crisis. It would mark the first major update to the state's mental health system in 20 years. Voters in 2004 approved a special tax on millionaires that has been used to fund mental health programs. Newsom wants to add more restrictions to how local governments can spend that money, under his proposal. 2/3 of revenue from the tax would pay for housing as well as services for people who are chronically homeless and have severe mental illnesses, and drug and alcohol addiction. Democratic Senator Susan Eggman, who authored the bill that would reform how services are funded, said the changes would also help the state better assess programs' outcomes by requiring counties to provide uniform reports of how they spend the money. It's a crisis that we have turned away from for too long, Eggman said Thursday. The days of looking away are gone. The proposals won overwhelming support from state lawmakers, some of whom said the reforms are long overdue. But local counties said the new spending requirements would result in a loss of more than $1 billion, which could be detrimental to existing programs such as mental health outpatients, crisis, recovery and peer-supported services. Some Republican lawmakers also criticized Newsom's plan to borrow more money when the state faces budget shortfalls. It's one of several efforts by Newsom to reform California's mental health system. Last year, Newsom signed a law that created a new court process where family members and others could ask a judge to come up with a treatment plan for some people with specific diagnoses, including schizophrenia. That law would let the judge force people into treatment for up to a year. The program launched in 7 counties. In early October, Newsom signed a law earlier this week that would make it easier for authorities to compel treatment for people with untreated mental illness or addictions to alcohol and drugs, many of whom are homeless. California is home to more than 171,000 homeless people, about 30% of the nation's homeless population. The state has spent more than $20 billion in the last few years to help them, with mixed results.